Everyone, thank you so much for being here with us today. We are going to go ahead and get started. I'd like to welcome all of our guests today. We have a very full agenda. I think it'll be really interesting, and we're going to go ahead and have Secretary take the roll.
Senator Rocky Adams. Senators Chambers Armstrong, Senator Berg, Senator Carroll, Senator Douglas,
Present.
Senator Elkins,
Present.
Senator Funky Fromeyer, Senator Nemes,
Present.
Senator Tishner, Senator Wise, Representative Bentley, Representative Bratcher,
Present.
Representative Bray, Representative Burke, Representative Callaway, Representative Dotson, Representative Duval,
Present.
Representative Frazier Gordon,
Yes, ma'am.
Representative Justice, Representative Neighbors,
Here.
Representative Palumbo,
Here.
Representative Raymer,
Here.
Representative Riley, Representative Rourks,
Present.
Representative Sharp,
Present.
Representative Weber,
Here.
Representative Wilner,
Here.
Representative Witten, Co-Chair Meredith,
Present.
Chairwoman Mosier.
I am here. Okay, we have a quorum established, and we'll continue on with our agenda. First, I'd like to entertain a motion to approve the minutes. Did everyone have a chance to read those?
So moved.
We have
Second.
a motion and a second. All in favor of approving the minutes from the last meeting, please say aye.
Aye.
Any opposed? Okay, the minutes are approved. So we're going to go ahead and get started. I wanted today to be a discussion about a real problem that we see not in just our state, across the nation, but I wanted to highlight some of the programs that we have here in Kentucky and really talk about some of the prevention initiatives, violence prevention initiatives that are working. And first, to give us an overview of the problem and the situation that we are facing here in Kentucky, we have with us Commissioner Phillip Burnett with the Kentucky State Police. Thank you so much for being here with us today. And as you make your way to the table, just introduce yourself for the record. And we welcome you and thank you for all of your work.
Thank you and good afternoon. I'm Colonel Phillip Burnett, Jr., currently the Commissioner of Kentucky State Police. And thank you for having me here today to hear about some of the progress that law enforcement in Kentucky has made over this past year, for the year 2022. One thing that I was here to particularly discuss was about the annual Crime in Kentucky report. That is a report that Kentucky State Police has compiled. We can track that back to 1978. Each year we take crime data that's submitted by all law enforcement agencies within Kentucky. They take it and they report that data to us. So in a nutshell, the KSP is basically the central repository for crime data. What we will do is then we take that data and then we will submit that to the FBI. And then they will do statistical analysis and other things like that as well to capture the events that's happened in Kentucky. With this data, what it is, there is a database. It's called NIBRS. It's a National Incident-Based Reporting System. And for that, we have 98% of all reporting agencies in Kentucky that were able to submit that to the FBI. The FBI basically considers one submission the most accurate and timely and efficient that they can have. And Kentucky is one of the few states in the nation that has that capability. To expand from that as well, the Kentucky State Police, we have a reporting system. It's a unified reporting system that we call Kentucky Ops. And what that stands for is Kentucky Kentucky Open Portal Solutions. That is a database, a reporting system that Kentucky State Police offers to all agencies in Kentucky. It's free of charge, it's free software, it's free maintenance, and it's free support. And all agencies in Kentucky utilize that reporting system, not just for crime reporting, but also for traffic enforcement or traffic collisions, except for 4 agencies in Kentucky. Those 4 agencies do utilize our online collision and e-citation, but as far as the NIBRS reporting, they have their own private reporting capabilities. So, but what they do is each month they take their crime data and they submit it to us, and that's how we tabulate the annual Crime in Kentucky report. I think we sent that out to everyone to be able to look at and see, to be able to review. It's also available on our website, KentuckyStatePolice.org. When the report came out, it had some very promising crime statistics that we were able to review. Not only for the Kentucky State Police, but we report this so every law enforcement entity in Kentucky can look at it and they can tailor their needs for public safety per their county. And that's how it's broken down in per county. But some of the highlights that we had saw was a reduction. Well, to step back a little bit, with the FBI, they classify violent crime as 4 different categories: assault, homicide, robbery, and sex offenses, forcible sex offenses. With the Crime in Kentucky report, we had a reduction. Now, this is based on information that was submitted to the Kentucky State Police, entwined with KY Ops that we operate. But it had a reduction of assault by 3.73%. I had a reduction in homicides by 33%, robbery 16%, and forcible sexual offenses by 6.8%. We have determined that they may have been a issue with reporting on homicides with LMPD. We're still looking at that to see if that's on the reporting software, if that's on how that come about. But they were less homicides that were actually submitted for the Crime in Kentucky report than was actually tracked there. But still yet, from what we do know, there is anywhere from a 30% to a approximately 19% reduction in homicides across the state of Kentucky. Obviously, any homicide, any violent crime against any Kentuckian is unacceptable, and that's what law enforcement works toward. But to give you some other statistics, as far as KSP, what we have tracked, and this is, well, we're a primary Kentucky, we have statewide jurisdiction, and we operate in across Kentucky. But just what we have worked from the previous year, 2022 to 2021, we have a reduction of 5% in assault offenses, a 30% reduction in homicide, and we did work an increase of 16% of robberies and an increase of 4% of forcible sexual offenses. But that's just what KSP works. That is aside from the annual Crime in Kentucky report that we're still looking through to solidify some of that information. As a, one of the questions that was brought to me was how do we track homicide or violent crime with firearms? That's one thing that's very difficult for us to be able to track. What we can say is that a firearm was in that particular crime, but it may not have been as a result of a homicide or an assault. Just that a perpetrator may have had a firearm on their person at that time. So it's really hard for us to be able to track that without individually looking at every separate crime report for that. So that's just one of the limitations that KY Ops has and our crime reporting that we're not able to do at this time. I talk about some of the significant reductions in violent crime in Kentucky, but also just talk about three of our largest categories of arrest in Kentucky. The largest number of arrests that we have is illegal drug charges, which encompasses 18%. Assault, which is number 2, with 10%. And then third is DUI, which is 4.9%. One other particular statistic that we track that you may have reviewed in crime in Kentucky is also the assaults on police officers. That we had a reported crimes of 2,542 in the year of 2022. But again, as I talk about any type of violent crime or any crime against any of our fellow Kentuckians is unacceptable. But it shows how the partnerships with Kentucky, our local, other state agencies, our county, and even our federal partners, how we work together to bring these stats down, that they're not increasing like they are at other places. And that's a big endeavor by all of our partners, and that's not anything that's just KSP or any other entity. We utilize partnerships. That's part of our mission to be able to accomplish public safety. And by all of us working together, that's obviously that is improved. But we're not going to limit. We're not just going to be happy with where we're at. We're consistently using new equipment, technology, other investigative methods to bring down violent crime across Kentucky. We're very proactive. We want to be out on the horizon. We want to be proactive to provide for Kentucky instead of reactive. And as law enforcement, you have to be able to do both of them. But I think in today's time, using the technological means that we have, we have to be proactive about that. And partnerships. That's one thing we've been very cognizant of within KSP. I'll attend Kentucky Sheriff's Association and let them know that we're a partner. And if there's an issue that we can do or we can work together better to be able to provide a better public safety for our entities, that's what we'll do. But I want to take this opportunity to thank all the law enforcement that across Kentucky that have put forth such hard initiatives. But it's just not that. But law enforcement has to have support, and we've had support. We have great support from the General Assembly, from the administration, from our communities across Kentucky, and that's one thing we talk about. I mean, if you're going to be in law enforcement, there's no better place than being law enforcement in Kentucky right now. With the raises that was administered to Kentucky State Police, and also other aspects to help our agency, it's really warded off retirements and resignations. It's dramatically increased our recruitment. It's increased our numbers. When I was here 2 years ago, we were hovering around in the 700s. With the class, Kentucky State Police Class 103, that will be graduating August 11th, we'll be up around 940. And we plan on starting another class in January. And right now, we already have in excess of 500 applications. Those numbers are phenomenal for us. But our graduating class that will graduate in August is 51. So And I talk with other entities across state police agencies and highway patrols across the country, and they're really in awe of where we're at, on our numbers, on our recruitment and our retention and our pay. So I want to thank everybody involved for that for us. But obviously, I talk about some of the highlights, but crime is still here, and I said if we have one single violent crime, that's too many. But we're going to keep working. But the things we have is, we still have our victims advocates. Each of our 16 posts across the state has a victim advocate. We still do community outreach. We do Trooper Island, Angel Initiative, Handle with Care. We have an apprenticeship program, Shop with a Trooper, Cram the Cruiser. I can go on and on and on. But Kentucky State Police, as well as other agencies across Kentucky, we've become, I think, more involved in community efforts than we have in my 28-year career. But that's something that's grown over my career. I mean, we really push for our troopers and officers to be at schools, at sporting events, at any type of thing that we can do to interact with the community. And I think they support us. I mean, they support us because we're a part of the community. And also with trust. We want the community to trust us. Now we're rolling out a body cam system. We want to have support, and we're only as good as how the community supports us. And I think that we're very successful there to this point. But engagement is what it is, engagement and partnerships. And as long as we can keep going with that, I hope that these crime rates, especially violent crime rates, continue to go down. And I hope next year that our numbers are down much more than what they are today. But I know one thing, Kentucky State Police and our partners in law enforcement will work to make sure that it is. Some other things I was asked to talk about is what strategies are we doing right now to combat. First of all, I talked about our community involvement. We have to have our community being involved with us to be able to talk to us, to be able to provide us information. As I talk about, our number one arrest are illegal drugs. We've really expanded our criminal interdiction teams, and some of the illegal drug seizures that we have across this state are phenomenal. Huge seizures of fentanyl, methamphetamine, illegal firearms, those type things. They're working every day to ensure that if they do come into this state, that we're taking them off our streets and out of our communities. But, it's just not proactive, as I talked about, but we want to educate. We provide programs at schools, like for our electronic crimes branch, providing things for online bullying, cyberbullying, those type other crimes, anything to feed upon our children. That's the things we look at. We have to protect our most vulnerable, our children and our elderly, and then we work out from there. But we consistently modify our strategic plan, to look, what are the oncoming obstacles and oncoming issues in Kentucky, and we continue to do that, and I feel like we've been pretty successful so far. Some of the things that we've done in the past has prepared us to answer some of the issues that Kentucky has faced in the past few years. But again, you had the Crime in Kentucky report, and I know my time is limited. I could sit here and talk about some of the successes that we've had, but that's all I have, and I'll open it up to any questions.
Well, Commissioner Burnett, thank you so much for this great report. It's certainly good news to hear that some of our violent crimes are down, and I love hearing about the initiatives that you've undertaken, and just in terms of community policing, generally speaking, and all of the different initiatives that you've talked about. It might seem strange to have a hearing on violence in health services, but we know that violence and all of the varying facets that we see, all the different types of violence that we see certainly affect health and the well-being of our families and our communities. So I guess, we have added all of these programs, the Angel Initiative, the Handle with Care, all of the wonderful work that you all are doing, and I think we're seeing the fruits of those efforts pay off. Part of what you're going to see today are some other potential partnerships, and I would love to see KSP work with all of these groups, and you probably are already, but and certainly you're aware of them. I love that you're in schools. Bullying is a huge problem. Cyberbullying is becoming more and more of a problem. That's a tough one to handle. We see, increased suicidal ideation in kids, and I think that's probably a big part of it. We have a couple of questions. I have one quick question about the crisis intervention training that KSP receives. Would you estimate that most of your officers are trained in CIT?
Oh, I would be saying it's close to half. That is, we're consistently, there's only so many slots available for crisis intervention technique training, and it's a very good program. And that's something, especially our cadets, when they come out, they are getting that, but we're trying to bring in our more seasoned troopers and officers, and then we're pushing those through as we have the availability in spots.
Okay.
But we make sure whenever there's a spot open that we fill that up with someone from KSP that we can.
Okay, perfect. Thank you. Representative Whitten.
Thank you, Chairman Moser. Thank you so much. It's great to hear that especially violent crime is going down. I did want to know, do you have any percentage of recidivism for specifically violent crime, to know are these the same handful of perpetrators, or are they, do you have that information?
I'm sorry, Representative, I don't have that right now, but I will look to see that we can obtain that and get that information to you.
Thank you. One more quick. Do you find that with most of the violent crime that it is that there is a large case of recidivism?
Well, it's really difficult to be able to track on a KSP level because we are statewide and we deal with so many. We have 16 posts, plus we have our specialized branches. It's hard for us to determine, kind of how that would be looked at. And every post, they'll look at their crime data that we have, and they tailor their enforcement efforts as far as crime reduction and violent crime to that particular area. So it would be hard to say as a statewide endeavor kind of what that is.
Okay. Representative Palumbo.
Thank you, Madam Chair. Commissioner Burnett, appreciate all you're doing to help keep Kentuckians safe.
Thank you.
My question is, on page 3, under state offense data, sex offenses consensual. I'm a little confused by that. You have sex offenses and then sex offenses consensual.
What those would be, ma'am, that would be a type of incest or statutory rape. It would not be like a forcible rape. That would be what we would consider consensual. Or it could be where someone is a person of authority. Those type things is what that is. They're broken down in those two categories.
Thank you. Thank you, Madam Chair.
Thank you.
Representative Sharp.
Thank you, Madam Chair. Commissioner, thank you, and I really appreciate everything KSP is doing for our Commonwealth. I want to talk a little bit about the Angel Initiative. How does that program, is that working well for you guys? It
is. Seem like our numbers have went down slightly, but we still do push that program. We advertise it. It's on our website. Our troopers are aware of it. If they see someone that they see may be a candidate, they'll even talk about it. How that program can be very beneficial for them to help them out of the drug addiction that they may have.
Now, is that a KSP exclusive program?
They do have that in other states, maybe other agencies, but far as Kentucky, it's the only one that I'm aware of. They may, Jeffersontown may have that program on a local level, but I'm not for sure. But as far as a statewide initiative, we're the only one here.
Do you think it would benefit the Commonwealth if it was to grow throughout other law enforcement agencies in the state?
I think anytime that you can expand services to anyone that's in need, that it would be very beneficial. I mean, if other entities do it, because, one thing, we have 16 posts across the state, so obviously those are spread out across the state, where they're not necessarily as small and localized.
Yes, sir. Thank you very much. Thank
Thanks.
you, Madam Chair.
Senator Meredith?
Thank you, Madam Chair, and thank you, Commissioner, for your presentation and information, and happy 75th anniversary to State Police. And
Thank you, sir.
we appreciate the job that you do. Co-Chair Moser made a comment about it may seem unusual to have Kentucky State Police report to health services, but crime is costly, particularly in terms of health dollars, and we only have so many dollars available to us, particularly gunshot wounds. It can cost literally thousands of dollars to take care of those. And so we appreciate anything you can do to impact crime in Kentucky. To that end, what can we do as a legislator to help you do your job?
Just the continued support that's been offered to us, make sure that we're competitive in pay, which helps with our recruiting, and supporting with our budget, that we have with all the initiatives that we provide Kentuckians. As long as those are the things, monetary support and just public support that we have, as we've went the past few years, and I think that's what we need.
Just a quick follow-up, please. How is recruitment now since we've made some changes to?
It's been phenomenal from where it was. We are starting a class in January, and we have over 500 applications so far. Those numbers are very inspiring, and we're graduating a class of 51 on August the 11th, and we actually started the second largest class that we had ever started for this current class that's graduating. So our numbers are up, and the great thing about it is we've not had retirements or resignations, because ours are our most seasoned troopers and officers. They're most experienced, and those are the ones that we really need to hang on to as long as we can. And we've had, typically this is a big retirement month. I think I've had 2 retirement memos, and that's it, where we may average in the high 30s or low 40s.
Great. Does that increase the probability of me getting a speeding ticket on the Bluegrass Parkway? No, just
Well, especially after August 11th when those other 51 graduate. They will be doing traffic safety for the Commonwealth.
Representative Weber.
Thank you, Madam Chairman. I have a question, but I also have a comment that I want to make. The comment I'll make first is a follow-up on Representative Palumbo's question. I'm going to begin by saying I don't think that I would categorize incest as consensual. So maybe you need a new category for that. And also, could you provide us with more detailed data on that? Because I think there's probably more categories in there than we might think.
Yeah, and they would be. And we categorize those things by FBI on our reporting statistics. And I'll be glad to break that down for you and get that to you as far as we can, that our data allows to. But on our reporting data, we just go by what's FBI statistical requirements. So that's how we come with that. It's nothing that we think about a particular offense. That's just some of the reporting issues that we have.
Okay, I'd certainly like to see that. My question relates to another category on the state offense data sheet, relates to bribery. We've seen a 70% increase there. Can you kind of give us some insight as to what who's being bribed? What areas are we dealing with there?
I picked that out as well. But the only thing, it's nothing at a huge increase that KSP that we have saw on our investigations, but we don't have the ability to look at the investigations of other agencies that report. We just take the data that they submit to us and we compile that. Now, what that could be, why that went so high, is you could have one offense where someone was accused of trying to bribe 50 people. Then that becomes 50 counts. So it could be just a couple different instances that makes that so much bigger. But without a deep dive into that, I would not be able to elaborate on that.
Okay, we still have a long list of legislators and colleagues who would like to ask questions. If you have a question that we can push off a little bit, I'd like to move ahead. Okay. Senator Berg, was yours specific to KSP? Quickly, thank you.
Thank you, ma'am. Very quickly, sir. This data by county, first of all, I really appreciate you being here. I really appreciate the quality of this report.
Thank you.
The data by county would have more significance to me if it was standardized. So if we could go per 100,000, so that way we have something to compare 23 to 490 and know what the difference is, if that makes sense.
It does.
So I would really appreciate that if it's available. And then very quickly, my second question, which doesn't have to be answered, I just want to bring it up. I don't see where we're talking a lot about cybercrime and specific. Is that because it's integrated into every one of these categories, or because it's separate and we just didn't include it here?
That they could be included in other offenses because they could be a multitude of. It's not just a cybercrime. It could be what that particular offense is. So those are included on that. But we're always looking to expand as far as reporting. The FBI really pushes entities on breaking different things out where they can gather data, where they can look at it as a thing for how to tackle the issues across the country in Kentucky. So they will push those down to us, and we'll see about how expanding some of those reporting categories.
A very quick follow-up. This cyberbullying, like when those of us who receive it, like I got an email last week from somebody who gave me his name, gave me what state I could look him up online. I could find the guy, who says he can't wait to watch me bury my second child. There's nobody to report it to. I don't even know who to call and say this is happening. So just for another time. Thank you.
Thank you.
Thank you. We have Representatives Dotson, Rourke, and Wilner. Do you all have a question for the Commissioner?
Thank you, Madam Chair. Thank you, Commissioner Burnett, for coming today. I want to ask this question. With your vast years of experience in the law enforcement, do you see a direct correlation when we, as a General Assembly, are tougher on crime, that crime does come down? For instance, the fentanyl bills that we're trying to pass, things that we're trying to do, do you see a direct correlation, us helping you when we are tougher on crime?
I see that a combination of things, holding people accountable as well as getting people treatment, and I think that's a based on two different things. To be able to help someone, if they've committed a crime, but there's treatment as well as enforcement and holding people accountable. So I do feel like those marry up with each other.
And going forward, do you see areas that we as a General Assembly could fix? Because you guys have worked within the parameters you've been given, what we can do to help make your all's job a little easier?
Just the continued support that we've had. Since I've been on the command staff the past 6 years, we've had great support from the General Assembly. We've requested equipment and finances for competitive salaries, and that's the things that make sure that we remain the premier law enforcement, with those things, because it takes us a while to catch up, if we lag behind. But as long as we keep where we're at, just keep growing, I feel like the agency will continue as aspiring that we have.
Okay, thank you. Certainly, I think with the results that we're seeing in this report, you can expect continued funding. We are very, very thankful for all the work that you're doing, and it's making a big difference.
Thank you.
Representative Rourke, do you have a quick question?
Very quick. You mentioned KSP's victim advocates or victim services. Either you can follow up at a later time, but I would be interested in who those folks serve, like who qualifies for services, and are those services where the people who work in that department reach out to victims, or do victims need to find them?
We have it both ways. Typically, our victims advocates will reach out to them if we come across them in an investigation. Or, they do outreach efforts like we do Shop with a Trooper, Trooper Island, those things that we see some of our needy children. If they see a direct correlation for victims advocates to be able to help and assist those, we do. I mean, if we were to have a tragic incident on our highways, our victims advocates are always far out and reaching to be able to interact mostly with our cases, but we're also available for any of the law enforcement agencies that operate within that post district, because they may not have those resources. So we offer that as well to them.
Thank you.
And Representative Wilner.
Thank you, Madam Chairman. Thank you for the report. Thank you for your presentation, and thank you for the work you do. It's a great report, ton of information in here, very detailed. I'm interested if there's anything in here, if I were to dig into the whole report, about gun violence, because guns can be associated with a lot of different crimes. So is there a place to see that specifically, and are you aware of any trends around violence that includes a firearm in the state?
As far as our data and what we're able to collect, the only thing we can collect on, I mentioned what KY Ops was. Every agency in Kentucky utilizes KY Ops except for 4. So what we can determine is if a firearm was involved, but we cannot say if that firearm was involved in the assault, in the homicide, just that there was a firearm involved somehow. That's the only thing we can track. So we can't necessarily track it based on our capabilities right now with firearm violence. But I do know, we continue to look to be able to expand and to be able to collect such data, because, one of the things that we're very successful, we have a very robust intelligence section. And we have criminal analysts at all 16 of our posts. And we also, that is another service that's offered to all of our agencies, our local agencies, that they can utilize that. But intelligence is like technology. So we're consistently using that intelligence to make sure that we target the most violent criminals in our communities. And that's one of the good things about crime in Kentucky as well. You can see that report per county, and they can see not just what their agency is doing, but whatever other agency operating in that county is doing.
Okay, thank you so much. I really appreciate all of the great information and your work keeping us all safe. We're going to hear now from Christy Burch with the ION Center, and hopefully you'll get some information that you all can use too.
Thank you.
Thank you.
Thank you.
If you can just introduce yourself for the record and go ahead with your presentation.
Let me hit this really quickly. Hi, you all. My name is Christy Burch. I'm the CEO of the ION Center for Violence Prevention. I'm so grateful to be here. Thank you, Representative Mosier. Thank you, Senator Meredith, for having us talk about power-based personal violence and also what's working. I have been doing this work to try to end power-based personal violence for almost 27 years now. And for the last 17, I have been filled with hope when it comes to how we can actually impact our communities. And that all started with a very small little dot, green dot. So I'm going to talk to you about that, where it came from, and also how it actually works and what we're doing here in Kentucky. So many things we get to hear today are what we're proud of about Kentucky, which is really incredible. So I'm very grateful to be with you all. So you're already hearing me use this term power-based personal violence. When I say that, I mean intimate partner violence, domestic violence, sexual violence, bullying, cyberbullying, stalking, elder abuse, child abuse, all of those pieces, right, where someone has power over another person. We've been around. Some of you might know us as Women's Crisis Center. In 2021, our focus, we do the same kind of work, but we focus so much on prevention. and what we're doing, and everything we do is funneled through those lenses. And so you're like, ION, what does that mean? Everything that propels our agency forward ends in those three letters, ION. So prevention, intervention, transformation, collaboration, protection, compassion, all of those things end in ION. And I would be remiss if I didn't take a moment to appreciate you all and the support that you've given the ION Center and all of our programs. We are a dual designated program, a rape crisis center and a domestic violence program. And the support that the General Assembly gave us really helped propel us even further forward. And so we're super grateful. Also to Senator Rocky Adams for that Safe at Homes Act. That also was really incredible. So thank you. I also want you to have a sense of, because of that investment, and I'm just one of 13 and 15, right? Because of that investment, we have provided over 25,000 safe bed nights, 73,000 meals. Like we are responding to every hospital call. So we are able to do so much. And then if you're looking at prevention, in the month of November alone in 2023, the ION Center trained 7,000 high school students. So we are there every day doing this and couldn't do it without you. As I bring that back to Kentucky, even more so, what we know is that 1 in 7 Kentucky youth are physically hurt by a dating partner. 1 in 10 youth are sexually assaulted. And we know, you all know this, we have the highest rate of interpersonal violence here. But we're doing something about it, and I want to get to that good part. Again, all the things that we do are through these 3 levels of prevention. But again, based on your time, I want to get to the good stuff, Green Dot. So what research tells us is for folks to actually engage in violence prevention, they have to do these 5 things. They have to believe there's an issue. They have to believe that they're a necessary part of doing something about it. Know what to do, how to do it, and it's got to be manageable. So Green Dot, if you didn't know this, it's Kentucky proud. Born at the university, I worked alongside Dr. Dorothy Edwards. I think it was about 2007 when we created Green Dot. It has now spread to 42 states across the nation. It has been adopted by people. It has been adopted by the Pentagon, and I believe the Navy. And so Green Dot has spread, and we have led the way, and it's working. So if you can imagine, you're like, what does Green Dot even mean if you haven't heard, right? A red dot to us is a moment in time that somebody makes a choice to hurt somebody. So it's the time that it takes to send that email to you, Senator Berg. It's the time that it takes for somebody to hit their partner, the time that it takes to sexually assault somebody. We know that we've got enough red dots in our state that 46.3% of women are hurt, right? We know this. So in order for us to do something about it, we've got to have a solution that's similar. And that's where Green Dots come in. Green Dot is a moment in time that somebody makes a choice to keep something from happening in the first place. It's a moment in time where somebody speaks up and says, do not say those kinds of things. It's a moment in time that somebody causes a distraction when there's a kid crying and you feel like that parent's going to hurt them, causes a distraction in the Kroger. It's the time that it takes to call 911 to get somebody else to help. There are 2 types of Green Dots. So I also want to point out why this works so well. It's because there's lots of options and lots of ways to get involved. So Commissioner was talking about proactive. We don't have to wait for the generations of families to come through our doors, which is why rape crisis centers and domestic violence programs have been leading this charge. We don't want to see generations of families get hurt. So we can proactively work with our communities and endorse 2 new behaviors. Violence isn't okay. Everybody's got to do something about it, right? And then also give people skills, tools, and knowledge to see something and actually respond. So this is all about bystanding. It's about knowing our greatest resource is all of us. If we know what to do, how to do it, and it's actually manageable, it works. And people jump into this quickly. We also don't have to have a lot of personal growth. How many times have we gone through a training where you're like, all right, just be brave and stand up. This is actually, there's a Green Dot for you. You can truly do something directly, you can delegate it, or you can cause a distraction. So again, Green Dot is based on who you are as a human being and what community you're with and how to do those. Goal is very, very simple. more green dots than red, and we watch those numbers come down. So we can't afford to wing it with folks' lives. You can't either. We cannot afford to wing it. Just because something feels good doesn't mean we should be doing it. So what we know, we were part of a 5-year CDC research project on green dot. What we found in green dot high schools, there was a 17 to 21% reduction in sexual violence. That was presented in the Journal of Preventative Medicine. So again, when we think about the health consequences and we think about the connection, we know that we create safety through this program. And we also know that that applies to other pieces of the work that we do. As you can see, I talk very fast trying to get in all the things. Ion Center has the first green dot city in the nation. In Maysville, Kentucky. We're very proud of this. What we were able to do is take 6 subgroups in our community, including healthcare, nonprofits, city and county government, education, church faith-based communities that actually started in the faith-based communities, trained 15% of the leaders in that community, and we were able then to become the first green dot city in the nation. It has now informed the state and the nation. We're going to hopefully have the second in Covington, Kentucky, and we just launched our next green dot city initiative in Warsaw. We also have rape crisis centers all over the state who are also providing green dot to high schools, colleges, and communities as well. Ion Center has the largest prevention team because a really important piece of this for me is that we provide half of our resources to primary prevention. We have to keep this from happening in the first place, and we can create safer communities. So Maysville is a green dot city. It also works, if you're thinking, why 15 to 20% of folks trained in a particular subgroup? It's diffusion of innovation theory. So that if we train those popular opinion leaders, those influencers, to model and endorse the behavior, we actually see it diffuse throughout the community much faster. So, and the other good news, like I'm all about sharing good news. Nonviolent people outnumber violent people, especially in power-based personal violence crimes, 20-1 to 40-1. If we engage those bystanders, give them skills, tools, and confidence to do that, we truly do have safer communities. The other added bonus of Green Dot, you all, is meeting people where they are. Because what we know, a high school student isn't necessarily going to walk into the crisis office of the Ion Center for Violence Prevention. We want them to. We have a crisis text line, but they're not going to walk in. When we're at our high schools and we build that long-term relationship, we're in 13 high schools right now, out of the 43 in our region. As those folks will disclose, or they will ask for support, or they will connect to a guidance counselor, and we see that time and time again. We have 5 years of data at Ion Center, and 55% of the high school students that we talk to have experienced sexual assault or seen it. 73% of our high schools have seen or experienced dating violence. 58% of our community members, and we've done comprehensive community trainings, have experienced power-based personal violence, and 46% of our college students have also experienced that. So what this does, not only do we prevent it hopefully from happening again, but happening in the first place as well, and we connect people to resources while we're in our community. Again, we've been training lots of folks. We've trained the Attorney General. Ion Center's trained the Attorney General's office, all of their staff, all of the faith-based communities in Maysville, all of the, again, the bars and restaurants, Braxton Brewing, Mad Tree Brewing just had us come in and train their staff. It is something that everybody can jump into, and it's manageable. And so I wanted to give you a sense of what that really looks like, what we're able to do. So it starts with about 25 folks, and it can last, for a community, it lasts about 3 hours. The training is virtual. We're able to access many more people now. Everyone also gets a 50-minute overview speech or a 90-minute overview speech. And so there's lots of ways that we can tailor this and adapt it. But again, we have been working really hard to engage all members of our community to be active bystanders. So I wanted to leave you with some of these to give you a sense of what it looks like on that community level and how it can be structured. You can find us in a whole host of places to learn more about what we do, but I'd also love to open it up for questions.
Oh my gosh, Christy, that was so fabulous and such great information. And it's exciting that, we have this great program in our state, and it started here and it's spreading nationally. It's very exciting. I just want to thank you for your work. And you kind of answered my question. I had a question about funding.
Right.
So do you charge businesses to come in and do the training?
We charge Mad Tree Brewing. They have money. So we were able to charge them, actually all of the schools. And when we do Green Dot Cities, that's all free of charge. So all of those subgroups were free of charge. So it is really critical that we have that funding support, because we only want to charge for folks like Paycor has connected with us, and they named a stadium. So we think they can probably pay us $25 a person. But everything else we do is free of charge.
Okay.
Thank
you. That was really my only question.
Okay.
I'm excited to see that this is spreading, and the concept is very doable, as you say.
Very
I mean,
doable.
it's giving individuals a tool that anyone can do. So
Right.
I think that's really where violence prevention starts.
Right.
So, Senator Douglas, you have a question?
Thank you, Madam Chairman. Ms. Burch, I think this is really an exciting program.
Yes.
And I think you bring a lot of enthusiasm in here today, but I don't like throwing dampers on the fire,
that's
but
okay.
I like to ask good questions
Please.
if I can. Your program is certainly helping the people who are in the pipeline. In essence, I apologize. I just use plain words.
No, please.
We're basically going back and we're doing remedial work that wasn't done at home.
Okay.
Okay? We are. Mm-hmm. Okay. I just want to make sure that we all...
I thought there was a follow-up.
No,
there
is.
So meaning
there
like...
is. Well, my question is,
Yeah.
Because I think this really is great training right now. How do we get our parents involved with our young ones in the beginning, in the early stages, so that we're not always having to take care of such large numbers in the pipeline? I mean, do you have any suggestions in that area?
I think that's a tough question. I think helping people understand what healthy relationships look like is a great way to start. I mean, the earlier we can start. But I also think that helping people understand that bystanding and being an active bystander is possible. I think even us as adults find it challenging sometimes to think we can make a difference or what is a safe way to intervene. And so I really even think this is looking at, like, how do I recognize somebody outside of myself? Not how do I fix what's going on for my family, but how do I go to school, and if somebody's bullying another person, that I feel like I've got words that can keep my social credibility, because you got to do that in school or you're not going to step up, keep my social credibility, but also increase the safety at our school. So it's not even exactly about the victim and the survivor. It's more about how do we create communities that are safe and thriving? How do we create communities where we take care of one another and have some skills and tools to combat some of these complex pieces? Does that help a little bit?
Well, just one short one, Madam Chair.
Please.
Well, no. You and I are in perfect agreement. We're in agreement.
Right.
Yes. My question is, how do we do this? You're out there on the street. You know what's going on.
Yes, absolutely.
How do we, I guess, and I'm asking everyone this, how do we do this earlier? Because most of our programs are meant to remediate things that weren't done.
That weren't done.
That weren't done. Learning how to communicate when we're 7 and 8
right.
and 12.
Right. Which, again, we've got our middle school program, which I didn't talk about. So all the rape crisis centers do middle school work, which helps. But you're right, the elementary piece too. But I also do think it's about this community that says violence isn't okay. And if we all do our part, we send a really powerful message to those perpetrators. That's, I think, also why we saw a 17 to 21% reduction in perpetration, because those folks were even in this community being trained, right? And they're hearing their peers say, this is not okay. And we're not going to stand for this here. And it actually shifted and changed their behavior. So you're right. We want to be proactive, right? But we also are working ourselves into that earlier and earlier. The more that we change those adults around us, right? And that we make communities say that violence isn't okay, and we all have to do something. We see that modeled all around us. I believe that's going to trickle in earlier and earlier.
Thank you very much.
That's my experience.
Thank you, Madam Chair.
Of course.
course. Okay, thank you. We have one more question from Senator Berg, and then we're going to move on because we've got a lot of presentations.
A lot of folks. Absolutely.
Thank you. This has been extremely, extremely interesting. I wish we could get it more statewide.
Would love it.
This is a question that I've been angsting about, and I don't know if you know the answer, if you feel like you can impact the answer, but last session we limited the amount of discussion that we're allowed to have at schools about family relationships, sexual education. I'm assuming that's going to include sexual violence. How do we make sure that our children are informed and knowledgeable about being able to protect themselves when we're not even allowed to talk about this in our schools anymore? That's my question. I'm worried that we're actually making it easier for people who want to take advantage of children because we're no longer allowed to teach them how to protect themselves.
I keep going back to the bystander piece. We are all bystanders. And if we have skills and tools and we're able to be those active bystanders, and we help folks understand and look at high-risk situations or what could be a high-risk situation, how do we intervene earlier and earlier and earlier, right, in those situations so we don't have a victim that we're talking about, right? So I think that's why primary prevention and focusing on that and funding some of that is so important, that we get ahead of this before we're even talking about violent relationships or things that, again, we serve any survivor, right? But we want to try to get to folks before that even happens, the most proactive piece. So certainly is difficult. But again, we're focusing on that active bystander and not on the folks who've been hurt, right? In this program particularly. Thank you.
Thank you so much. This was wonderful.
Thank you. Thank you for having me.
Appreciate it. Oh, of course.
Thank you so much.
We will stay in touch. Thank you. Next, we're going to hear from the Children's Home. Executive Director Rick Wurth is with us, as is Julie Raia, and we're going to say about 10 minutes, if you can. Just give us an overview of why early intervention with children is so important, and of course, what you're working on. Thanks.
So I'll introduce myself for the record. I'm Rick Wurth, and I have the pleasure of serving as the CEO at Children's Home of Northern Kentucky CH&K Behavioral Health.
Good afternoon. I'm Julie Raia, and I'm Chief Strategy Officer with CH&K Behavioral Health.
I'm thrilled that to be in this room, Chairwoman Mosier, Chairman Meredith, while we have all of this brain power focused on health and wellness. And I think it's absolutely thrilling that we're talking about violence as a health and wellness issue and how do we prevent it. And I think it's fortuitous that we're following the ION Center because the questions naturally started gravitating to what are we doing sooner rather than later? What are we doing with younger populations? And I think maybe after 145 years of existence as a children's home, we might be able to contribute to that discussion that has started today. Violence is a health and wellness issue, and if we dig deep enough, we will find out that violence, like so many other social ills, has two key ingredients. There's always two ingredients in so many of the problems that we're dealing with in Kentucky and across the nation. Sometimes they're referred to as co-occurring disorders, mental health and addiction. And I think that we might have some work that might be of interest to you that's happening at Children's Home of Northern Kentucky. So there are efforts to integrate mental health services across healthcare, educational, judicial systems. They reap benefits. Our problem so many times is that they have a short attention span, that will pay attention to mental health issues only following a national crisis or a crisis here in our own Commonwealth. The question that we're addressing and have been addressing at Children's Home of Northern Kentucky is how do we bring early intervention services, Representative Douglas, you were just asking about that, to youth so that we can reduce the prevalence for violent behaviors and so that we'll have long-term sustainable results. We have been working on a 4 four-pronged solution at CHNK. We're presenting that to you today. And the four prongs of our approach, number one is embracing a culture of trauma-informed care. The second prong is moving mental health services upstream. The third prong of our approach is advancing implementation of evidence-based practices designed to address violent behaviors. And then finally, expanding access to mental health services and reducing barriers that are preventing people from getting the care that they need in a timely way that's convenient. So I'm going to take the first two prongs, and then my Chief Strategy Officer at CHNK is going to take the last two prongs. Our first prong is creating a trauma-informed environment. I know many of you are coming from a healthcare background. It's no surprise to you that trauma-informed is some wording that can be batted around very haphazardly in this day and age. At Children's Home, we don't bat that around casually. We are the first provider in the Commonwealth of Kentucky, and currently the only one, to have teamed up with the international movement called the Sanctuary Model of Trauma-Informed Care. We got licensed in that approach in 2016. It's international in scope. It was born in the 1980s in Philadelphia, and it has spread around the nation. So Sanctuary Model is a blueprint for clinical and organizational change. It really focuses not on CHNK becoming the best children's home in the Commonwealth, but rather, how do we become the leaven, the yeast for creating a trauma-informed wider community with healthcare organizations, with our education partners, with the court system, with law enforcement organization. Sanctuary Model also helps us to realize that it's not just the victim, it's not just the person who's experienced trauma that can experience adverse experiences. Our systems that are supposed to be helping can become overwhelmed very quickly. And I'm talking about systems such as the Cabinet for Health and Family Services, DCBS, child welfare providers across the Commonwealth. So Sanctuary is really an organizing principle. It's an approach to life. And at its basis, it's a movement away from what's wrong with you to what happened to you. We have to learn to speak the language of trauma. The second prong is moving services upstream. Dan Heath is a New York Times best-selling author. One of his newest books is Upstream. We have passed that out to every one of our managers, every one of our board members, and in fact, that's what we've been doing over the last few years. How do we have the right services at the right time, at the right place, at the right level, so that we do not continually try to drink out of a fire hose where more and more families are imploding in Kentucky because of the violence of child abuse, child neglect? How can we move those services upstream? And so what you're looking at in this particular graphic is the work that we're doing across multiple healthcare, education, and judicial systems related to more outpatient services. Our goal had to change. We could not simply sit back and say we want to be the best residential care facility. That would not be helping the Commonwealth. I do think we have a great residential care center. Our goal is to make sure that Kentucky families don't need DCBS to begin with. What are we doing to move services so that families don't implode? What that looks like specifically for us is expanding day treatment services in schools, expanding family preservation in families where there's an imminent risk of a child being removed into cabinet custody, growing partial hospitalization. And that's not just for the kids. What we realized is if we provide services to kids only, we can do that until the cows come home and we're still not creating social impact. We have to simultaneously prevent violence and provide treatment services to adults who are raising kids. And so there's a big movement in our organization to grow partial hospitalization both for adult caregivers and for children. And finally, how do we move into, as child welfare providers, into a digital-first mindset? Sometimes non-for-profits are Johnny-come-lately to some really important aspects of social movements, and we can't afford to be Johnny-come-latelys in this arena. In other words, we know that telehealth services is a vital part of healthcare in the Commonwealth now. Our Children's Home has provided over 10,000 telehealth services since the pandemic began. That's not going away, and it can be very effective in beginning an approach for the right services at the right time.
I'd like to quickly note that the use of evidence-based practices, specifically those that address certain concerns such as violent acting out, substance use disorder, and even criminal behaviors, are vital to our approach, and we believe one to any violence prevention initiative. Trauma-focused cognitive behavioral therapy is one that's very commonly used and very sensitive to the unique problems of youth with PTSD specific to abuse and violence. But functional family therapy, which is fairly new to the Northern Kentucky area, targets youth with presenting concerns that add the violent acting out behaviors and substance use behaviors. Multisystemic therapy, right now CHNK is one of just three organizations in the Commonwealth utilizing MST to work with the older adolescent population who have already experienced involvement with the juvenile justice system. Our fourth prong, of course, is expanding access to mental health. I want to just quickly take a moment to demonstrate the level of need. Need is outpacing availability, especially since the onset of the pandemic. So in a recent report from Mental Health America, Kentucky was listed 31st in prevalence to mental illness among youth and in relation to access to care. To put that into context, 15%, nearly 51,000 Kentucky youth ages 12 to 17 experienced at least one major depressive episode this past year, but only 59% of those actually received the needed care. Professional shortage areas are also exacerbating barriers to access. So per the County Health Ranking and Roadmaps report, Kentucky's ratio of residents to mental health professionals averages 390 to 1 versus the national average of 350 to 1. That may not sound too terribly off center. However, there are counties in Kentucky that have as many as over 4,000 residents for every one mental health professional. And in the 12 counties of the northern bluegrass region, there are many, the ratios are much worse. There are counties with as many as 6 times the number of residents for every one professional mental health provider. So together we believe we can do more. CHNK has experienced some real success in expanding its services, utilizing this 4-pronged approach, and we'd like to build on this success. CHNK is committed to a 5-year expansion plan that will allow us to help to double our impact and close the gap.
So we started in 1882 as an orphanage, and we had the luxury of sitting in a very nice house on a very large hill, and we waited for people to ring the doorbell when they needed us, and then we opened the doors, and we took really good care of them after that doorbell sounded. We can't afford to sit on a hill in a nice house waiting for the doorbell to ring. We have to get out there and move services forward, and that means having partnerships with a purpose, and not simply partnerships with other like providers. We have to have partnerships that are lateral and horizontal if we're going to create a solution to this issue of violence in the Commonwealth. So we certainly have referring partnerships with St. Elizabeth Healthcare, with Cincinnati Children's Hospital Medical Center, with Sun Behavioral Health, with Pediatric Associates of Northern Kentucky. But you might expect those kind of relationships given the fact that we do work in the mental health arena. I think you might be interested to know that every school superintendent of every public school district in Northern Kentucky has signed a letter of support for our 4-pronged approach, and especially our growing access to mental health care. We just presented to every police chief in the Northern Kentucky area, and we're preparing to go and expand that conversation with all police chiefs around the Commonwealth of Kentucky. As you can imagine, as you heard from our law enforcement official from Kentucky State Police, many times law enforcement is being called for a mental health issue for an addiction treatment issue. And so it is very, I think, interesting to note that we have the school superintendents and the police chiefs as part of our continuum of partnerships.
So in closing, we'd just like to note that we can reap many benefits by creating these collaborative partnerships, and in this way create an easier path to mental health. So some of those results being a reduced number of youth in juvenile justice system, reduced youth suicide rates, reduced number of children in state's custody, and certainly safer communities. At this time, we'd be happy to take questions.
I just want to thank you for being here today for this presentation and certainly your work in Northern Kentucky. And I wanted everyone to hear about an example of a really great and robust program who is thinking upstream. And thank you for that recommendation. I read the book. I recommend it to everyone. It's an important part of being proactive. And so we have a couple of questions. We are going to do this quickly because we've got a few more presentations that I want to get to. So Representative Adams, Adams. Oh, Senator Julie, sorry. I'm so sorry. I was like reading that completely wrong.
Thank you, Madam Chairman. I was just curious, have you all experienced any change in reimbursement rates for your foster kids, or have those reimbursement rates stayed consistent like the last year and a half?
Just recently, we did receive an increase in the reimbursement rate specific to a residential treatment for youth who are wards of the state. Our outpatient services, though, rates just recently changed. There was a slight increase in some of the services, not all of those services. So certainly we do find ourselves in the position of having to find other ways to serve more with less. But with that in mind, we also reach out to the managed care organizations and see if we can't negotiate some higher rates in that way. I would just note that 91% of all of CHNK's revenue are Medicaid dollars, so we do serve the underserved.
Senator, I can just also chime in as the CEO, and one of the reasons that we have been able to effectuate this kind of upstream movement has not been because of our dependence upon the Medicaid rates. Those need to be addressed in our humble opinion, but we have been very fortunate at CHNK to find private donor dollars to help us fund the work that to fund the blueprint that we've put together here. It's probably no surprise to any of you. You heard from Kentucky State Police that the additional dollars had impacts. I would propose to you the same thing is true in our approach in child welfare, mental health, addiction treatment services as well.
Can I have one follow-up, Madam Chair? As you know, we're coming up on a budget year, and these services that you all provide are increasingly important to stabilizing families across the Commonwealth. So I'm encouraging you all to stay engaged in this process so that we can understand what your pressure points are coming up on a budget session, because that's when we're going to discuss all of these dollars, and we need to make sure that you're a part of that conversation. So thank you for your presentation today.
Certainly.
Thank you, Senator Adams. I do know your name. I would like to add, while we're talking about funding, that Children's Home is really doing a lot of work in raising those private dollars. And so, when the state is able to match your hard work, I think it really pays dividends for everyone. So I know that the Home of the Innocents is doing the same. I would just, I applaud those efforts because, as you know, our tax dollars are stretched very thinly. Yes. So, Representative Wilner.
Thank you very much. Thank you. This wonderful presentation, and I'm behind the camera. I can't see everybody. But I really appreciate the work you're doing. So much of what you're talking about, getting upstream, the system-wide trauma-informed approach is written right into Senator Wise's 2019 School Safety and Resiliency Act, getting more mental health providers into schools to provide that primary treatment and to have the trauma-informed approach. My own sense is that we have not invested enough in that approach, and I'm just curious, from your vantage point, are you seeing that work in the schools? Are you seeing it having an impact? That seeing results that, in a positive way, that by having trauma-informed schools in Kentucky, that's changing the trajectory for some of our kids, or do we need to do more?
Certainly.
I think I can take an initial stab at that, and then I'll ask Julie to make sure she's chiming in on anything I'm missing here. But I can tell you this, Representative, the public school districts in Northern Kentucky are our largest customers. They were the first ones knocking on our door as we began this four-pronged approach and expanding access to services. The school districts are in dire need of more support services related to addiction treatment and mental health. And it's not just for the students, it's also for the families of the students and for the parents who are struggling to get the student to school on time, etc. I know this is anecdotal, but we actually had a school district at a considerable distance from CH&K pile all of its leadership team members in a van and drive up to my office one day asking what it would take to get more additional services in their school district, which is in one of the regions Julie is referencing where there's a drought or a lack of mental health care professionals. So the school superintendents are our closest collaborators right now.
Thank you very much.
And Senator Wise.
Thank you, Madam Chair. Representative Wilner, thank you for that shout out. And we're working together as a school safety task force funding that's working on this interim. My question to you is, have you had any discussions or collaboration with the Kentucky Center for School Safety? And I appreciate the work you're doing with the superintendents. I think that's exactly the right pathway, but I'd also like to know, has there been any discussion? If not, I would strongly encourage, if you can, to reach out to the Kentucky Center for School Safety, as I think this collaboration can continue to improve.
Senator, thank you. And I can tell you, sometimes the answers are yes, no, and not yet. That would be a not yet. And so, but Julie's our Chief Strategy Officer, and we will make sure we heed your words, and we'll make that contact.
Thank you for that. Thank you.
Okay. Thank you so much.
Certainly.
I really appreciate your being here today, and of course, thank you for all the work that you're doing. And
Thank you. Thank you.
Love partnering with you, and
Thank you.
I love the coordination that you're able to really pull together in Northern Kentucky, and hopefully we can scale this on a statewide level. And but anyway, great example of what we should be doing.
Thank you.
So,
Chair Moser, thank you.
Thank you. Okay, next we will hear from our community violence prevention partners, Christopher 2X, Dr. Miller, and Dr. Jones, and I think, is Rob Givens here with us as well?
Rob is not here.
Okay.
Yeah.
All right. Okay. Oh, I know that he was coming from elsewhere.
Right.
Yeah. Okay.
Thank you.
Of course. Just introduce yourselves for the record, please, and welcome. It's a pleasure to have you here with us.
Yeah, so Representative Moser, thank you, Chair Moser, and every one of you all for you all's work, for your constituents, and equally at the same time, our little few moments with you guys is about the kids in the Commonwealth, and especially, specifically Metro Louisville. I'm Christopher 2X. I'm the Executive Director of 2X Game Changers. Our focus is about kids 4 to 13 years old that have been affected by either first or secondary trauma issues due to violence. To my left, you all's right, is Dr. Keith Miller. He's a trauma surgeon, Department of Surgery at U of L Hospital, U of L Health. To my right, you all's left, is Dr. Christopher Jones. He's the Director of Transplant at U of L Jewish and the Traeger Center at University of Louisville Hospital and Health. And they are here as collaborative partners in the work as it relates to kids. I'd quickly like to say, because Dr. Miller is going to, Chairwoman Moser is going to handle our presentation of slides and everything that entails. But I'd quickly like to say about how we got to this space. And it's based on many kids across Jefferson County in Metro Louisville who've been impacted by the violent crime issues. I first want to say I want to thank you for inviting such informative guests, the Kentucky State Police Commissioner, ION, and also the group that just spoke in front of us just now, which is CHNK. They were so informative. Our work is so concentrated in Metro Louisville, we don't get to hear from others around the state about the great work they're doing. Kudos to you all for bringing them in front of us with informative information about what they're doing in the Commonwealth. But with that said, our work just springboards out of so many kids who are impacted by violent shootings, not directly impacted where a bullet hits them, but kids who unfortunately have to change their lifestyles because bullets enter into their dwellings, into their homes, hearing gunshots at nighttime. Actually, in school season, where they have to refocus their whole mental health efforts and their efforts of innocence to try to get back into school and learn in a focused and healthy way based on the trauma that they're surrounded by in their neighborhoods. In Jefferson County alone, really quickly, in the last 4 years since the pandemic has occurred, there's been 600 individual citizens plus now that have been lost to fatal homicides, 600 plus. And unfortunately, we're on a track in Jefferson County to enter into the 4th straight year with 100 homicides plus. And when you look at the non-fatal shootings that affect kids also, we're looking at almost climbing near 2,000 in that same 4-year time frame. And Dr. Miller will speak a little bit about that as a trauma surgeon and the kind of workload they have to deal with at U of L Hospital. But the hope that we're trying to bring to this conversation is the platforms we built. Within 2X Game Changers, we have this medical partnership that you'll hear about in a few minutes, which is the Future Healers Program for kiddos 4 to 13 years old that deal with this trauma. Equally, the spin-off programs is connected to the animal kingdom side of what we do. And Representative Moser, you and your husband, Dr. Moser, have visited the Future Healers Guide Sue Buddies platform as it relates to a nature-based therapy concept. And lastly, our newest one we're proud of, which we've enlisted 308 families in, which is our Planet Savers Nature-Based Therapy Projects, which allows the kids, I had this idea that we wanted to spread our wings into the Commonwealth and see the beauty of the Commonwealth through retired horse farms and working farms as at least a substitute. If a family is not good with traditional therapy, which we're advocates for, we try to send families to therapy if they need therapy through our partnerships. But we have to have a game plan B, and that's these platforms we built for what we call nature-based therapy, and especially our proudest platform, I believe, which is the Future Healers platform, where we pair these kiddos up for kind of a STEM connection with surgeons and medical students who create their curriculum for that kind of positive growth in their life. With that said, I'd like to turn it over to Dr. Keith Miller so he can present our slide presentation and then turn it over to Dr. Christopher Jones.
So I think today we've talked a lot about reactivity and proactivity, and I can't think of, I'm a very small part of our most reactive tool to combat this issue, which many of you are as well, and that's in the hospital, where we try to stop bleeding, we try to patch holes, we try to get individuals back to their lives. Here we're going to talk about a proactive measure called the Future Healers Program. The why, I think we've talked about the why here enough, but this is a study we did about a year ago where we looked at the years of potential life lost in Jefferson County to interpersonal community violence. So you're looking at, and compared this, tried to compare it in a way that could make sense to people to the COVID pandemic. And here you can see that we lost almost twice as many years of potential life to gun violence in Jefferson County as we did to the COVID pandemic. That's not to de-emphasize the importance of the COVID pandemic to those of us that lost people. This is to just re-emphasize that there's this other issue going on in our state, in our county, that's exerted an equal, if not more, of a toll on our community than the other. There's two reasons for this. One, the case fatality rate for a firearm injury is high, right? If you get shot, there's a 1 in 5 chance based on our data that you will die as a result of those injuries. The second piece is that it disproportionately impacts younger individuals. And that's how we're going to transition into talking about future healers and talking about those proactive measures. It's a complex issue. We all know this. If there were easy solutions, everyone in this room would have had them and we'd be moving on. But the socioecological model helps someone like me understand the complexity of this issue. As you talk about individual level issues, interpersonal, how we deal with others, community. We've heard several examples of ways that people are working at that here in this room today, and how the impact of an individual can butterfly out to impact society as a whole. I think if you look at the numbers in Jefferson County, you're talking about 129 injuries per 100,000. So you're talking over 1 in 1,000 people that are injured. But what's the true impact of that? And the true impact of that is that those individuals have families, they have loved ones, they have people that care about them. And that family moves through that trauma together. And these can result in adverse childhood experiences. I can't tell you the number of times that I've gone out into a family room and talked to families, giving them the worst news that you can imagine, and there's multiple children in that room with them, and their lives are forever altered in a way that many of us hopefully can never imagine. So you talk about these adverse childhood experiences, you talk about multiple injuries throughout the community that intersperse, and then you talk about the way that this impacts society as a whole and results in sort of a perpetuation of this cycle. What is an adverse childhood experience? We all know that in this room, but they're potentially traumatic events that occur in childhood. They influence your outcomes throughout your life, right? They're connected to lung disease, kidney disease, stroke, coronary artery disease, diabetes, and not unsurprisingly, violent injury. There are protective factors. This is the plus side. I don't want to bring all doom and gloom to this meeting. There are protective factors. And as we look at the Future Healers program, what it's really about is it's trying to add. We can't do everything. Senator Douglas, you brought up some good points about that, working in the family. We can't do all that, but we can add layers. As a community, we can add layers. We can add for these protective factors that you see with the green check marks here. And that's what Future Healers is about. What can we do as a community to add these protective layers so that when these things do happen and you have adverse childhood experiences, this is one mechanism, the one that we're talking about here today, whereby you can add those layers and benefit society, community, and families as a whole. If you want to talk about where it's at on the prevention intervention continuum, we've heard a lot about that today on this continuum. Future Heal. Here is where I'm at. I don't know if this pointer will work, but this is where I'm at down here. Tertiary, individual, one patient at a time. That's what we do. One patient at a time, one family at a time. The beauty of Future Healers is it's up and to the right in the prevention intervention continuum, and that's important because now you're changing community and contextual preventative strategies. What's our mission? Your guys were like, well, they're talking a lot about it, but what is it? Yeah, our mission's pretty clear. Build stronger bridges between the healthcare community and our local youth most impacted by gun violence. We're talking about 4 to 13-year-old children here. Chris talked about this a little bit, but 85 to 90% of those children have been impacted by violence in some way. Some have been shot. Some have lost brothers, sisters, moms, dads. Some hear gunfire on a regular basis in our city. The model is a collaborative institutional community partnership, and we work towards violence reduction through improving the overall health and well-being of our youngest citizens. So here's the partnership. You can see University of Louisville School of Medicine, the medical students were the thought leaders behind this and actually brought these groups together. You talk about a Department of Surgery, you talk about U of L Health, and then obviously these institutions don't work without facilitating the work that happens in the community, and we found the perfect partner in Christopher 2X and Game Changers. And so this is the model that we work with. How does it work? We meet monthly for a couple hours at these locations within Louisville. If you're not familiar with Louisville, Galt House Hotel's a hotel in Louisville, the Chestnut Street YMCA. We have many events at the hospital itself, which the kids love. We talked about associated partnerships with the zoo, and I always tell Chris, I never forget that the zoo always beats the hospital. I mean, can you imagine trying to compete with the zoo? Not a chance. But
not easy.
Not easy, but we try. So these are some of the places that these things happen. They happen on a monthly basis. We talk about a variety of things. We talk about Stop the Bleed. We talk about nutrition, mental health and well-being, fire safety. We bring experts from outside the fire department, the EMS. A variety of partners have been in there. We teach them a little bit of surgery. That's what Dr. Jones is for, and myself maybe. But and so we go through this whole curriculum. The results, this is what it looks like. Again, this is a 2-year-old program. It's grown beyond our wildest dreams. I soon will be able to give you some more concrete results where you can say, okay, I can sink my teeth into that. But for now, for us sitting at this table, these are results enough to see this on a monthly basis. It is translatable. This is the other thing that we talk about. It is translatable. It is a model that you can take not only in the medical community, but also if you're in engineering or law enforcement and you take the pieces from this model, partnering with the community partner, taking an institution and putting the time and effort into it. Our most recent partner is Vanderbilt, and they've expanded the program to Nashville. Certainly many of you heard about the high-profile shooting that happened in Nashville several months ago. That prompted the group to reach out to us and begin this program. So it is a translatable model, can work well beyond the healthcare space. And so with that, I'll turn it over to Dr. Jones to continue.
Yeah, one quick thing on the numbers. So in July of 21, when we kicked off the Future Healers program, the concept came in around the fall of 20, but we started with 25 participants. And as of today, when we kick off in August, on August 12th, our 23-24 medical curriculum session year calendar. We have 120 kids now, and we plan on expanding it even way more than that. So, Dr. Jones?
Yeah, so am I on?
You're on.
There we go. So I know a lot of people ask, well, what's a transplant surgeon doing as a part of this, right? You don't have anything to do with trauma and everything, but it kind of goes back to something my grandmother used to always tell me, and I just want to read it, and it was her quote. She said, most people don't want to be a part of the process. They just want to be a part of the outcome. But the process is where you figure out who's worth being part of the outcome. And that always struck me. And I said, you know, I need to get out of the hospital, and I need to be more involved with the community, with these medical students, with our community partners in order to curb the violence that we're seeing in Louisville. I just want to say, as far as Future Healers is concerned, it is a brand new kind of never before seen type of program that's out there. And one of the things that we demand, and this goes back to Senator Douglas and one of the, his questions he brought up, we require that when we have our lectures and our fun time, that parents are there. Parents have to stay. Right? And it's like I tell everybody, this is not a babysitting service. All right, this is something for parents to come and learn from, as well as the kids. And believe it or not, the parents actually learn a lot, I would think, depending on the things that we're talking about there. We also have to recognize the needs of all of the different entities that are involved, right? Whether that be the children, whether that be the parents, and whether that be the medical students. And I try to bridge the gap between all three groups in order to make sure that everybody's getting what they need out of the program in order to make sure that we can move forward in a good way. So with that,
So one last thing, Representative Moser, before we open up the questions, so we give great clarity to everybody in here. We never tout ourselves as the ones who are going to stop violence on the front line. Okay, we're being honest about that. This is a long-term approach, but this came out of a need, again, when we started to see kiddos many years into observation starting to pick up some of these behavioral issues at the earliest ages. I've had elementary school principals tell me that, Chris, we're losing kids before they start K through 12. And when I thought about that, I thought about how easy it is now for a kid to take a cell phone and start to navigate that cell phone at 2.5 and 3 and 4 years old now. So they can absorb stuff like a sponge on the positive side, on the negative side. We just want to be on the front line to let them know there's choices. And the goal is, if you got, and they do, have family members who are active in these kind of unfortunate activities and behaviors as it relates to violence, specifically violent shootings in a reckless way. we know that these kiddos can at least be an example by saying, I love you, but I'm not going to follow this destructive pathway. And hopefully that rubs off. And like Dr. Jones said, Chairwoman Moser, that one thing we did when we started these platforms was, and we had a hunch, that if the parents could be invited in and could buy into this wholesale with us and stay at the sessions, this could be something that could rub off on them in a positive way. And we're just scratching the surface, and hopefully we're going to expand these services to others in Jefferson County and wherever else we might take it. So.
I just want to thank you so much for being here and for all the work that you're doing. You know how excited I am about your program. I brought Christopher's, the concept. Chris, you were busy when we were in D.C. at a meeting and wanted a presentation about game changers. But I want to see this go across the nation. I think that this is addressing the trauma, of course, and the hopelessness that these kids are often experiencing. And Dr. Miller and Dr. Jones, thank you for being here. I know how hard it is for you to clear your schedules to be here. And I just want to point out that these individuals are not being paid to do this. It's because you care about the community and about the kids and how we reach them really early. And so thank you for setting a great example. Thank you for reaching these kids before their lives are turned upside down. And I think that you're a great example of a program that's working and that we really need to share. So, Senator Berg, you have a question?
Please. I want to share with you how overwhelmingly proud I am of our university, of our medical school, and of you all. And the work that you are doing in this community. It is amazing, amazing work. And I cannot thank you enough, and I cannot tell you, and I can't express how proud I am of you as community members and as physicians to take this initiative. It just, bless you, bless you.
Thank you. Too kind to say that. Okay. Representative Moser, one last thing as it relates to, even the Vanderbilt connection. It all started when we went to Washington in June of 22. And the Justice Department asked us to come up there because there was a federal partner who brought this to their attention, and said there's something, I don't know what it is in Louisville going on with a medical component and an animal kingdom component that's trying to treat trauma from something we've never seen before. And so that panel discussion allowed a federal partner to connect to Vanderbilt for them to understand what we were doing. And that's when they reached out to us at the end of March of this year. And we're on a pathway for the expansion in Nashville, and very appreciative of it.
I think it's great. You're providing opportunities for kids where they wouldn't have had any. And so I think, that's a wonderful piece of all of this. And not to mention the fact that we might actually increase our healthcare worker pipeline, right?
Yeah.
So I think that's a pretty smart part of all this. And then, I just want to point out that the KMA is the Kentucky Medical Association is recognizing game changers, and Chris, your work and all of your work this year as you're, I think, getting the Distinguished Service Award this year. And so that's exciting. But I did have a parent talk to me about what this meant to him as a parent when I was at the Louisville Zoo with you all. And he said, if I had had this opportunity when I was a kid, it would have changed my life. So I think it's wonderful. We have one more question, and then we've still got a couple of presentations. So I just want to thank you so much for being here.
Thank you for the invite.
Senator Douglas.
Thank you so very much, Madam Chair. My comment is this: I don't think many in this room really understand the depth of what you're talking about. I think what you're doing now is you're changing the conversational narrative from an emotional narrative to an objective narrative. And you two gentlemen know what I'm talking about in terms of where we work. I really am proud of you all. You don't understand what pioneers you are. Most people are afraid to move in this area. And so you gentlemen, all three of you all, are really moving into an area that needs to be explored further. And I just, you're changing the narrative from who I want to be like to who I don't want to be like. And I want to applaud you all for that. Thank you, Madam Chair.
Senator Douglas, really quick, one thing that should not be dismissed in regards to what we're trying to attempt to do. Violence is one part of this, right? But we sincerely want, especially kids from challenged spaces, to be acquainted with the health sciences. It's good for them, and it's good for them at the earliest ages that we can acquaint them with it.
Absolutely. So, all right, well,
Thank you.
We don't have any further questions, but I would love to continue the conversation. In fact, I already talked to you about moving up into northern Kentucky, so I'm working on that.
We're going to talk about it.
Yep. All right.
Thank you.
Thanks,
Thank
you all. Okay. Next, we have CHI St. Joseph Health here, and I know Sherry Craig, you have organized a great group to be with us. So if you can just introduce yourselves for the record, and I will just have you go ahead and proceed.
Well, thank you, Chairwoman Mosier and Chairman Meredith and members of the committee for giving us this opportunity to share with you information about CHI St. Joseph Health's grant-funded violence prevention initiatives. I'm Sherry Craig. I'm the Market Vice President for External Relations for St. Joseph, and I'm joined today by my colleagues who are doing the violence prevention work in the communities. Want to introduce yourself?
Hi, my name is Demetria Blair.
I'm Jared Burkhart.
I'm Brian Hill.
St. Joseph's vision is a healthier future for all, inspired by faith, driven by innovation, and powered by humanity. Across our geographic service area in central and eastern Kentucky, our caregivers daily help patients grappling with the consequences of acts of violence. We know that medical care accounts for around 20% of the variation in health outcomes for a population, whereas 80% can be traced back to social determinants of health, for example, a safe environment. We also know that community violence impacts people's health, both physically and mentally. Violence can cause significant physical injuries and mental health conditions such as depression, anxiety, and post-traumatic stress disorder. Living in a community experiencing violence is also associated with increased risk of developing chronic disease. At St. Joseph, we are committed to building healthy communities by addressing the social issues and root causes that can lead to poor health. About 15 years ago, our parent company, Catholic Health Initiatives, launched a national campaign called United Against Violence. Today, CHI is part of Common Spirit Health and continues to provide millions of dollars in grants through its Mission and Ministry Fund on a crisis that is in large part preventable. In Kentucky, we have received more than $7.5 million over a 12-year period. These grants enable us to reach beyond our hospital walls in London, Lexington, Berea, and Bardstown to address root causes and not simply respond to the horrific consequences left in the wake of violent acts. The funding supports initiatives that raise awareness on many fronts, including child abuse, youth dating violence, and bullying. So today we appreciate the opportunity to highlight our violence prevention initiatives. We'll start with our London program.
Again, my name is Jared Burkhart, and I lead the Nurturing Children program within CHI St. Joseph Health in London, Kentucky. So the Nurturing Children program, the primary focus for that program is to reduce incidents of child abuse and neglect. Our program is unique in the fact that we do home in on infancy to age 4. We do this because the child abuse, the Child Fatality Review Panel will tell you that children who are 4 years of age or younger are at the highest risk for experiencing a fatal or near fatal event due to child maltreatment. So to combat that issue, what we have done is we have implemented evidence-based parenting practices in our community. This equips parents with skills necessary to reduce the high-risk behaviors such as belief in corporal punishment or lack of empathy. And as you can see here on our slide, 89% of our parents who have completed this program have not recommitted acts of abuse, of child abuse and or neglect. So we are very happy to be able to provide that education in our community. With this recent funding, we were able to expand to other categories that focus on near fatalities and child fatalities, including gun, water, fire, and infant abandonment. And so to save time, I'll skip right to our highlights. We have been able to provide over 200 pack and plays to really decrease unsafe sleep practices in our community. We have been able to provide car seats to over 30 families that really promotes safe travel for our infants. We have also been able to distribute over 40 medication lock boxes to decrease the risk of overdose and ingestion for children. And we have been able to implement the 80 Eagle Gun Safe program. This has been a very successful program in Knox County, and with its success, we were able to go into another district this school year. And then lastly, we were able to put in a Safe Haven baby box. This was placed in Corbin, Kentucky. This was the first to be placed in rural Kentucky, and another is coming to the London area soon. These boxes covered under KRS provide mothers in crisis an alternative to safely surrender their infant.
Good afternoon. My name is Demetria Blair, and I am the Violence Prevention Manager for the Creating Safer Neighborhoods in Lexington, Kentucky. And our focus is on reducing violent crimes committed by and against youth. And it comes on the heels of reports out of Lexington that shows that 60 youth victims of assault with weapons, it comes on the heels that Lexington has reported that there have been 60 youth victims of assault with weapons, and 42 of those victims were in their 20s or younger. The youngest homicide victim was 16, and the youngest shooting victim was 10. This follows that national conversation that's happening that says that homicides are the third leading cause of death for young people ages 10 to 34, and the leading cause of death among non-Hispanic, Black, or African American youth. So our approach to mitigating these troubling statistics is to do a few things. One, focus on education and promote youth access to quality learning opportunities. Also, focus on economic stability and advanced skill development. Also, focusing on building healthy communities and safe spaces in our community. And also focusing on those focusing on building healthy people and focusing on mental health.
Good afternoon. Thank you again for your time. My name is Brian Hill. I'm the Violence Prevention Manager for Berea in Madison County at St. Joseph Berea. I've been doing this for about 8 years. We've served over 5,000 students in that time. Our main focus is our programs. We do the Green Dot program that you heard about earlier. We also do a program called Sources of Strength. We serve 3 middle schools doing the Sources of Strength program and 3 high schools doing the Green Dot program. The focus, of course, is bullying, dating violence, sexual assault, cyberbullying, racism, and suicide prevention with those programs. One of the biggest things that I want you guys to be aware of is that 87% of the time there's a bystander when we see acts of violence in our schools. With the Green Dot program, we focus on bystander intervention to raise awareness. And the big thing is we want to change the culture. That's the whole focus of what we do with our programs. With Sources of Strength, it's more of a suicide-based prevention program where we focus on the strengths of the students and not only their own strengths, but how they can bring others along with those strengths. One of the things that I'll do, since the Green Dot program was covered so well earlier, I want to highlight 2 things that we do in our programs that I think has the most impact in our programs. The first is our personal connections. One of the things that we have to remember with these personal connections is that we're dealing with real people. We're not just dealing with statistics and numbers. We're dealing with real students who have real issues. And what we do with this program is we ask each student to anonymously tell us their story. What is your connection to the program? Why do you care? And over 55% of our students share stories, whether it's a personal experience or with a family member or someone that they're involved with, that there is a traumatic event in their, in their experience. And so, and this varies very greatly from just verbal bullying all the way to, we have an experience where a student was actually violently attacked by their stepfather and actually shot, and another student who for years was sexually assaulted by their mother's boyfriend. So we have students, and this is just a few of the cases that we hear, but these students share their experiences, and we expect them to come to school and learn, but they're experiencing these things on a daily basis. So I think it's so important for us to help understand that these students are dealing with these issues. And the other thing that we teach is actually a question. And this question, I think, is so important for us to ask every single time we see a situation of violence is, what if it was someone I loved? What if it was somebody I cared about that was in this situation, but the person, the bystander there, decided to walk away? How would you feel in that situation? And so I'm going to be personal with you guys today. I have a son who is 8 years old. He has cerebral palsy, epilepsy, ADHD, and he's been called a loser. He's been made fun of because he can't do things that other kids can do. And that's why I care. That's why I do the work that we do with these programs. And I thank you guys so much for your time today to hear the work that so many great people in this room are doing. And I appreciate your support moving forward. Thank you.
And just lastly, I will mention that we have a Green Dot program also in Bardstown, Kentucky, and Nelson County, where we're working with the Nelson County schools. Again, it's that power-based personal violence is not okay, and that no one has to do everything, but everyone has to do something. And what's your Green Dot? The Green Dot being that intervention. We're doing that through students by role modeling in the classrooms, having conversations, expressing support in meetings, classes, or among their peers. So we strongly believe that if everyone does their part, that we can reduce the number of people who are impacted by power-based personal violence on campus. Again, I know you've heard a lot about Green Dot today, so we'll just end it with that and be happy to answer any questions you may have.
Thank you so much for being here today. I love hearing about all the great programs. And again, I just wanted to highlight some of the really great programs that we have going on here across our state. And the work that you all are doing is making a huge difference. So I think what we are going to do now is, and I don't see any questions right now, but if some come up in the next minute or so, we can entertain those. But we were going to hear from the Safe KY application, about the Safe KY application, but actually Representative Ken Fleming is the sponsor of this. I was going to have him talk about it. He's talked about it before. I think we're going to push that off to a later date, but it ties in with this as far as crisis intervention and allowing kids to get the help that they need when they need it. So anyway, I think we've had a lot of great information shared today. Thank you again to everyone who was here. We have some regs that we're going to consider, and I know that the committee was, you received an email with all of the links. Did everyone have an opportunity to see those regs? Okay. We will consider those reviewed. I know that I don't know if the Kentucky Board of Nursing is here with us. Yeah. There were not questions about today's regs, but I just wanted to address something that members of our committee, I think, and others probably have heard about, and it's a reg that we passed last year, or was it in, January of 2022. It was 201 KAR 020-215 that had to do with the training for implicit bias. And I think that we had a couple of questions about this, and I understand that it was just implemented, and that's why we're just hearing about it now. There's an article that was written, and I had a question and maybe a comment or two, and I just wondered if it's customary for the Kentucky Nurses Association to develop training, which is mandatory for licensure renewal for the Kentucky Board of Nursing, and in terms of this particular reg on implicit bias.
Okay. And I appreciate actually this even being brought to light, because we have been getting several emails and some phone calls, and we have it on our website, but we are not endorsing any program that creates the program. There are multiple healthcare systems, and those systems have created their own educational programs for their employees. So while Kentucky Nurse Association has a program, it is not endorsed by the Kentucky Board of Nursing. Anybody is welcome to do any 1.5 CE training on the implicit bias. We passed that as well as the suicide prevention for nurses in particular. That was 2.0 CEs at the same time. So that's just trying to clear up. The other thing is that we would not take a nurse's license away from them if they have not completed the CEs, nor would we for any CEs. That doesn't constitute to the level of a threat to public safety. So we certainly would not take anybody's license. We go through our CE audit in November. That includes the suicide. At that time, we find somebody who hasn't submitted. We send them a notice that says, please submit your CEs. If they continue to just not want to do the CEs, then it could lead to like a civil penalty, like $100 would be max. So it's not anything, it's not a form of discipline if they don't do it. But we're welcome and open to any suggestions. If you feel like we need to remove it from our regulation, we're certainly open to that, and I can take it back to my board. Jeff and I were just talking, we were not in our positions when this reg came through with the implicit bias, and however, I know past experiences and certainly characteristics like that lead people to how they actually perceive, and kind of leads to some of the bullying and things that, we've heard about today from this group. And so, but we are open to anything. And if your recommendation is for us to remove it, then we'll take it back to our board.
Okay. Thank you so much for answering that so directly. I really appreciate that. And it sounds like then this is not mandatory for licensure renewal.
It is a
one-time.
It's a one-time requirement. And just to clarify, I was present. I took on the role of general counsel during the promulgation of this regulation. We did not, no hearing was requested. There were no comments that were shared. And in fact, there were a lot of, I think this one came through also with 320, which has to do the education. And I think there's reference to the implicit bias training also in 320. And just out of disclosure, for the pre-licensure programs. But to be clear, when we received a question from the media about this, the questions were framed in a way that are not accurate. It is a mandatory requirement, just like CEs are mandatory is a mandatory part of our CEs. However, just like any other mandatory requirement, it could result in discipline. If they just ignore the board saying, hey, do this. Most CE requirements result in a consent decree, which is a civil settlement, and we resolve the vast majority of them that way. Sometimes they go to more further discipline if there's a continued history, say within 5 years, because the consent decrees can be expunged after 5 years. But if they continue to flaunt the regulations about getting continuing education, it could rise to the level of reprimand. But in no way, in most cases, even most allegations that aren't CEs, other allegations, we do not deny nurses licensure. That only happens if we think we have enough probable cause to proceed on an immediate temporary suspension, which is a threat to the public. In this case, that we don't see this as a threat to the public necessarily. These CEs could be combined with something else, other allegations, but failing to get continuing education, we would certainly not take a licensee's license based on that. That's just not true.
Okay, that is good to know, and because I know that some of the some of the information that has been shared that's part of the training is, being identified as offensive. And so, I maybe we could have an offline conversation about what that really looks like, and if there are some nuances that we can change or tweak, maybe we can talk about that.
We would be open
I don't
to
think
that.
that you all identified yourselves for the record. I
Oh,
wasn't
sorry.
clear about that.
Sorry, I'm Kelly Jenkins, the director at the Kentucky Board of Nursing.
And I'm Jeff Prather. I'm general counsel for the Board of Nursing.
Okay, thank you. My apologies for not making that clear. And I think one last thing that I want to address that was in the article, it alluded to the fact that this was approved by our committee, and we only review regs. We don't actually approve regs. So just to make that clear.
True.
But we do work with you, and I appreciate your willingness to work with us.
I think when the response that and the response that was actually, I think, in the article was not the one that we gave. It was very terse and did not actually express our response fully. However, yes, we do appreciate that you consider the regs. And any more than when you said the reg was passed, we do appreciate that, yes.
Okay. All right. Thank you so much. Senator Berg, do you have a comment or question?
I have a question and a comment, I guess. I'm unaware of this controversy, so I'm not exactly sure what article we're talking about. I'm not exactly sure what requirements we're talking about, but I do want to speak to the importance of understanding implicit bias in medicine, because it is pervasive. And if you're not aware of it, if you're not aware of your limitations, your personal limitations from your personal world experiences, then you have no way to impact the real negative consequences that come with implicit bias. And if somebody wants an understanding of what we're talking about, there are studies that show if you have a black physician taking care of a black pregnant woman, her chance of surviving that pregnancy is significantly greater than if she is being taken care of by a white physician. There has got to be something in there that we as healthcare providers are not understanding, that our patients are telling us, or that we're not learning, or that we don't know to account for that. Because it's not intentional. It's not like we're trying to kill black patients at a higher rate than white patients. It's that, depending on who the providers are, that is actually happening. So to say there is no implicit bias, or to say that you're offended by the fact that somebody may be implying there's an implicit bias, is so against science. We know it exists. And if you're offended by it, well, I would say that the patients with a higher mortality rate are just, or if not more so, offended by their outcomes.
Thank you, Senator Berg. We'll make sure that you get the information so that you actually know what we're talking about. It was more about, not that implicit bias exists. We all have implicit bias, and I think it's important to assess that about ourselves, especially when we're taking care of patients. But there was a little bit of a shock value, some shocking slides, and so that was really what that was about. So, Senator Meredith.
I don't think anybody discounts the importance of the subject matter at all. I think it's the manner in which it's presented, and I guess I have a little difficulty saying something is mandatory, but it appears that you wouldn't give the assumption that it's kind of meaningless, but is it sort of like having a black mark on your permanent record if you don't do this, and it could culminate into something in the future. But again, not discounting the importance of the subject matter, but particularly this day and time when we have a difficult time training enough healthcare workers to fill the positions that we have here, if this is an obstacle to that, which I believe it is, I don't think we should be doing it. implicit bias is there. We know it is. It will always be there. And I think statements that we're killing patients is totally inappropriate. It's unwarranted. There could be 1,000 other reasons why the situation that it is what it is, most directly being that we don't have enough healthcare providers of the minority race. Should we focus on that instead? Mm-hmm. So I think if this is a lightning rod, particularly at this point in time, which I think it is, I think he should remove it.
So do you want me to take that directive back to my board and remove the requirement?
I don't think we're in a position to do that because, again, we don't act on regulations. We can say they're deficient and it's already there, but I think there's something that needs serious consideration from you folks for the very reasons I've talked about.
Well, I will inform the committee. We're about to bring 215 back for more promulgation. We had the removal of the X waiver last year, as well as changes to the Kappa CS requirements for our APRNs. And so 215 will be, I'm working on it currently, so now would be the time, frankly. And we'll be meeting with we're having a special meeting with our education committee this week, and then we'll be taking it back before the board with other regs in August to be filed in September. So we can certainly take these concerns to the board and to the committee.
Well, I think that it has been so inflammatory. The reaction to this should give you some indication of the impact this thing could potentially have. And I think there's a better way to do this, a different way to do this, and the fact that it's mandatory, I think, is problematic.
And I think this is a lesson learned. I think going forward, if the Board of Nursing has any mandatory CEs that we want to put in regulation, that we will create our own program so that there is no confusion between what K&A is doing and what the Board of Nursing is doing.
I appreciate that. Thank you very much.
I think that's a good idea as well. Okay, last statement, Senator Douglas.
Thank you, Madam Chair. I just wanted to offer a word of caution, and that word of caution would be, let us not confuse implicit bias from our healthcare providers with patient compliance and some of the socially learned issues. Being a black physician who has been in the healthcare area for 40 years, I think we have to be cautious about who we are throwing blame at for some of our health outcomes. I just think we need to be cautious when we start looking in that area. Thank you, Madam Chair.
Thank you, Senator, and thank you very much for your willingness to work with us. I certainly appreciate it. Okay, the next meeting of the Health Services Committee will be held on August 24th at 12 p.m. at the Kentucky State Fair. We will be serving funnel cakes and just kidding. But we do look forward to seeing everyone, and seeing no further business, we are adjourned.